and they do the flamingo test, that may or may not cause pain in the sacroiliac joint. If it does, then it's a positive flamingo test. Not the best test in the world, but it's there and it's in your arsenal. Second test that we're going to do is the Trendelenburg test, looking for the Trendelenburg sign. Similar to the flamingo, you have them raise their foot. What you're looking for here, first of all, is you're looking for pelvic tilt towards the unloaded leg. So once I raise this foot, if my pelvis tilts in this direction, that indicates weakness in the gluteus medius muscle. Yes?
So they can't have their legs pressing against each other?
Now, I'm trying to maintain my balance here, but yeah, it should just be raising your foot up. I just didn't want to fall over in front of the camera. So the second part of this test is if they don't experience that pelvic tilt, what you want to do is you want to have them raise up and down onto the ball of their foot a couple of times to see if that causes any discomfort or any pain. If it does, that is testing the S1 nerve root distribution. So you're looking for some S1 weakness or some gluteus medius weakness with the Trendelenburg test. So that's what we're looking for there. All right, I need a volunteer for Julie. Graciously volunteers. Have a seat and lay down for me, please. The next test is Gainsland's test. Gainsland's test is typically performed only on the affected side, and it's a test for sacroiliitis. If your patient presents with bilateral pain, you're going to do it on both sides. But for the most part, a lot of times they're going to come in with pain just on one side. They'll have buttocks pain on the right or on the left. In this particular case, we're going to say it's on the left side. So you're going to have your patient roll up onto the unaffected side. So roll up onto your right side for me, and I want you to bring your right knee up to your chest and hold it. And what I'm going to do is I'm going to stabilize her hip, and I'm going to hyperextend the hip on the affected side. What this effectively is going to do is put a lot of pressure against that sacroiliac joint and reproduce or exacerbate her pain. So that is Gainsland's test. There's another way that you can do this. You can have the patient lay supine. This is not the preferred way. Slide over to the edge of the bed, making sure that you don't have them fall off a little bit more. And then have them drape the leg of the affected side over the side of the table, effectively producing the same type of pain. The problem with this is the edge of the table puts pressure up against that area as well, and that in and of itself can cause pain. So I'm not a big fan of doing Gainsland's this way. I prefer, go ahead and sit back up and slide back over for me. I prefer just to roll them up. All right, the next test, I believe, is Patrick's, correct? Oh, the piston test. Okay, so the instability test. With the patient supine, you want to flex the hip to 90 degrees. You want to come through and place your other hand on the knee, grab your wrist, and you want to apply downward pressure onto the hip and then lift up on the hip. So it's piston, down, up, down, up, down, up. What this effectively is doing is taking the head of the femur and you're pushing down to try and distract it, or pulling up to try and distract the head of the femur out of the acetabulum. This is a test for dislocation or subluxation of the hip, and you want to see how much movement you have in there. You really need to be able to get in and get a good grip on this and lift up in order to get that leg to come out of the joint, and the same thing coming down. Both hands pushing down on the leg. All right. From this position, we're going to move into the Patrick's test or the Faber test. It's basically the same position, and the name tells you exactly what you need to do. First of all, flex the hip to 90 degrees. Then abduct the hip, and then externally rotate the hip. So F-A-B-E-R. Place the ankle just above the knee of the opposite leg, and you want to apply downward traction just to the point, nice pop, just to the point where the knee is level with the other leg. This, again, creates pressure against the sacroiliac joint, and this is the preferred test for sacroiliitis. The next test that's on there is piriformis test. So for testing for piriformis, it's basically the same test. What you're going to do is flex abduct, externally rotate, but instead of placing the ankle on the knee, you're going to place the ankle on the table opposite or lateral to the other knee. And again, apply slight downward traction, keeping the foot on the table. What this does effectively is it moves the pressure laterally from the SI joint to the piriformis muscle. And you'll get pain along the piriformis. So it'll be more in the buttocks area as opposed to the SI joint. So that is piriformis test. What's next? Ortolani's and Barlow's. All right, since we have no infants, yeah, no, we're not going to do Joyce again. No, I'm just teasing. All right. This is a test that really you perform up to about the age of 6 months. These are tests for congenital hip dysplasia or hip dislocation. You can't do these tests on adults. They're only on infants. So when we get to pediatrics, I will go over Ortolani's and Barlow's with you. So is that it for the hips? Yes. All right. We'll go ahead and practice